Hello, my dear students. I'm Dr. Vaishali Bharambe, Professor Anatomy. Today, we are going to be discussing Human Body Anatomical Terminology Part 2. These are all terminologies which are related to movements and joints. Okay, so come, let's dive in. Remember to sit for this lecture in your sports gear. Why? Because you will be exercising. Okay, so come on, wear your shoes and wear your comfortable clothes and let's learn. Okay, this lecture is about movement. So, identify each of the movements you're seeing on the screen. What is inversion? What is eversion? What exactly happens in pronation supination? If you want to know all of this, then let's learn today. What is axis of any movement? Let's find out. Right. So, flexion, extension, circumduction, abduction, these are terminologies we'll be discussing today. Let's learn. First, I'm going to talk about joint and movements. So, what is a joint? When two or more bones meet, what is formed is a joint. Is it essential that the joints move? No. There can be immobile joints. There can be slightly movable joints. There can be freely movable joints. A joint does not always essentially have to move, So, for example, now this is your hard palate. So, you see your teeth. Okay, I hope your teeth are also in such fantastic condition. Okay, so this is your hard palate. Okay, so do you really feel movement in your hard palate? I hope not, because chewing food will be extremely difficult if your palate started to move here and there. Okay, so it better not move, right? So this is an intermaxillary joint which is not moving. It's a fibrous joint. And let's take a look. Of course, this is the intervertebral joint. So this is a vertebra, this is your vertebra, and this is your intervertebral disc. How much movement do you feel between vertebrae? Actually, you can twist a lot, but that's because you have so many vertebrae. Actual movement between two vertebrae is very little. Little. Little movement between all of them finally results in big movement. So, some movement in intervertebral joints. Here you're seeing another kind of joint, okay? This is a primary cartilaginous joint within a bone itself. I'm sure you've learned about it. Okay? This is a joint that allows for growth, doesn't allow for movement. And finally, this fantastic joint, the ankle joint, allows for so much movement, right? So, joints exist, but their purposes are different. Some are for movement, some are for little bit movement, some are for growth. Okay, so with this, let's come to the common term flexion extension. Most of you are very well aware of what is flexion and what is extension. Just understand that flexion reduces the distance at an angle. If there is an angle, the angle usually reduces. That's flexion. The angle increases in extension, reduces in flexion. Common sense. Okay, there are a lot of descriptions given in your book. I strongly suggest go with this. Okay, don't waste your time. Nobody asks you to define flexion. Anterior surfaces are usually meeting in flexion, as you see in your elbow, but sometimes the posterior surfaces meet, as you see in your knee joint, right? But what happens when the angle increases? When the joint straightens out, you call it extension. See how beautifully her joints have straightened out here. That is extension. When the joint becomes straightened. Flexion, extension, done. Lateral flexion. Come on, do it. Just see, whenever I've written activity, it's expected that you do the activity. So stand straight and then slowly begin to bend sideways. Come on, do it. Okay, that's called lateral flexion. Students, if you're enjoying this lecture, do please like, share, and subscribe to my channel and hit that bell icon. If you want more of such detailed anatomy lectures with diagrams, surgical anatomy videos, draw and label videos, downloadable notes, MCQs, visit my website www.vbanatomy.com. Link is in the description section. Okay, so let's talk about medial rotation and lateral rotation. This is very important. Pay attention because here I'm drawing a line through his hip joint. a vertical axis through his hip joint. I'm introducing the concept of axis here. Pay attention. Imagine that such a vertical rod has passed through your hip joint. Now turn your foot outwards. Do it yourself, otherwise you're not going to understand. Turn your foot outwards. Turn your foot inwards. The joint, the axis is in the middle, and you're just turning your foot laterally and medially around that vertical axis. Okay? So the lateral movement is called lateral rotation. The medial movement is called medial rotation. The axis is that vertical axis around which this is moving. Okay? We'll have some more examples of axis. I'm sure you'll understand better. So that's medial rotation and lateral rotation. Please keep trying out all these movements. Abduction, adduction. Again, I want to draw a median plane of the body. Okay? Any movement towards the median plane is called adduction. Any movement away from the median plane is called abduction. Got it? When you move away from the median plane, it is abduction. When you move towards the median plane, it is adduction. Note that adduction, abduction are different for your hands and for your toes, but we will be discussing that later. Just put it in your brain. Right. Circumduction. Okay, so how many of you have seen Lagan movie? I'm sure many of you have seen it, although it's quite an old movie. And there is this man called Kachra in it. You remember the movement he was doing when he was bowling? That is circumduction. A movement which is a combination of flexion, extension, abduction, adduction. When that happens, it's called circumduction. Do circumduction, come on. Right. So we've covered so many terminologies. Fantastic, isn't it? And now we're moving to the axis of movement and all the rest of the terminologies. Right. Let's now come to axis of movement of any joint. Now for this, I'm going to show you a couple of bones. This is your hip bone, this is your femur, and this here is your hip joint. Imagine a vertical axis passing through the head of femur. So when the femur rotates forwards like this is called medial rotation around that vertical axis. When it rotates backwards like this around the same vertical axis, you call it lateral rotation. So again come back. Medial rotation, lateral rotation. So where is the axis? Here. The axis is vertical, which is passing through the head of femur. The head remains steady and the rest of the femur rotates around that vertical axis. You have to imagine this a little bit. So I'm going to show this to you now on the screen. Okay. So this is our imaginary axis. When the femur will rotate forwards, it's called, around this vertical axis, it's called medial rotation. When the greater trochanter goes backwards around the vertical axis, we call it lateral rotation. Got it? Okay, so you have to practice all this. If possible, acquire bone sets and practice all this. Right. So with this, we are now going to a horizontal axis. So this is again your hip joint. This time the axis is passing like this horizontally through the head of femur. Okay. Now around this horizontal axis, when you move the femur forwards, it's flexion. When you move the femur backwards, it's extension. Axis remains steady. The bone moves forward or backwards perpendicular to it. So what did you see? You saw that the axis was horizontal. Movement was taking place in a plane perpendicular to the axis. Forward movement was flexion. Backward movement was extension. Why don't you flex your hip joint and extend your hip joint now? Come on, get up. Flex your hip joint. Move your leg forward and up. Backwards and back. Up. Forwards and up. Flexion. Backwards and up. Extension. Simple. So what is the concept of axis? The concept of axis is when you have an anteroposterior axis, okay, anteroposterior, like this, okay, then when the bone moves towards the body, it's adduction. When it moves away from the body, it's abduction. Got it? When the axis is horizontal, then when the bone moves forward, it's flexion. When the bone moves backward, it's extension. And when the axis is vertical, when the bone rotates forwards and medially, it's medial rotation. When it rotates backwards, it is lateral rotation. This is only understood by actually doing. There's no point in my giving you theory if you're not going to practice it on yourself or on a set of bones. Okay? Right. Now I'm going to introduce something very fun to you. Okay? Unique movements in relation to axis of the joint. Hand, fingers, foot, toes. Right. Obviously, this is the hand. This is the hand. Now, for the hand, the axis passes through the middle finger. This is very important. You have to understand this. The axis passes through the middle finger. So now, when my ring finger moves towards the middle finger, it is adduction. Away from the middle finger, it is abduction. What was our rule? Towards the median, middle of the body, it's adduction. Away from the median plane, abduction. But the plane itself has changed here. This is the axis. When the fingers move towards it, it is adduction. When the fingers move away from it, it is abduction. This is abduction. This is adduction. Abduction, adduction. Abduction, adduction. Come on, do it. Do this. Practice it. Similarly, let's go to the foot. The axis for the foot passes through the second toe. So when the toes move towards the second toe, it is adduction. When the toes move away from the second toe, it is abduction. So movement of adduction and abduction is very relevant to the axis of that body part. Please understand this. So what are the terminologies we've covered? We've covered axis of movement. We've discussed the movement. Let's now talk about the last part of our class, pronation, supination, and so on. Come on. So now you're seeing a hand which is like this and then a hand which is like this. When the hand is like this, with the palm facing down, the radius and ulna are crossed. When the hand is like this with the palm facing up, the radius and ulna are parallel to each other. Okay. So this movement from here to here, when from parallel the radius ulna become crossed, the position, this is the final position, this is called pronation movement. And when they go back to being parallel to each other, the movement is called supination movement. Pronation, supination, pronation, supination. Remember, they are movements. They are not positions. This movement is pronation. This movement is supination. Got it? Okay. Please practice it. Now, let's talk about protraction and retraction. Obviously, this movement, when you want to box somebody, it is protraction. When you take your hand back, deciding whether shall I box him or not, it is retraction. Protraction, retraction, protraction, retraction. Got it? Easy? Okay. So this is protraction and taking the arm back is retraction. Now look at your foot. When you turn the medial border of your foot upwards, you call it inversion. When you turn the lateral edge of your foot upwards, you call it eversion. You'll be surprised at how important these movements are. When you're walking on a rough surface, do you know that your foot is inverting and everting all the time, helping you to maintain your balance? These are very important movements which we often underappreciate. Inversion, eversion is one of the most common movements we carry out and we fail to appreciate these movements. Turning the sole of the foot inwards is inversion. Turning the sole of the foot outwards is eversion. So what is this then? Easy. When the dark surface of your foot comes up, it's dorsiflexion. Dark coming up is dorsiflexion. Pale going down is plantar flexion. Dorsiflexion, plantar flexion. Dorsiflexion, plantar flexion. These are movements only at ankle. You can't say that I'm dorsiflexing my wrist. No. You are extending your wrist. You are flexing your wrist. But dorsiflexion, plantar flexion are movements seen at the ankle joint. But you should practice with the wrist. So flex your wrist, extend your wrist. Okay. Adduct your wrist, abduct your wrist. Did you see that there is a limited range of movement for abduction, more range of movement for adduction? So movements are variable as per the requirement of that joint. Not all joints show the same range of movement. So if you are liking this lecture, my dear students, do please like, share and subscribe to my channel and hit that bell icon. For detailed lectures in anatomy with diagrams, surgical anatomy videos, downloadable notes, MCQs, visit my website www.vbanatomy.com. Link is given in the description section. So this is what we learned today. We learned joint, we learned movements, we learned axis of movement, and we learned some fantastic terms related to movements. I hope you enjoyed this lecture. I'll see you in my next. Thank you. Bye.